Welcome to the show. My name is Lee, keeping you company. And right about now, we have Sahil Sharma, who is the founder of Ayoo.Care. What is Ayoo.Care? They are a mental health service. And we're going to find out more about this, why he started this, and what's going on in this entire field. Sahil, thank you so much for joining me all the way from US, actually, taking the time to talk to me this morning. Tell me more about yourself before we start and how you came up with the idea of, Ayoo.Care.
Hi, Lee, and thanks for having me on the show.
Gosh.
Ayoo.Care is basically a patient-centric mental healthcare service.
Mm-hmm.
And our mission is to provide easy access to anybody who needs mental health care, either virtually or in clinic. So there are three core pillars of what we call a world-class care, mental health care would be. So number one is good quality. So we have care providers who have been trained at the best institutes in the country, and they have long experience in mental health field. Second would be accessibility. So there are two things about accessibility. One is online accessibility. So Ayoo.Care on the platform, if you go to the website or download app, you can easily set an appointment. You get all the information you need to pick a care provider, and then you can easily set up an appointment with them. And not only that, with a click of button, you can actually join your virtual consultation as well. So that's one. Second aspect is in clinic. So we've been very deliberate in the way, in terms of choosing a location where we set up our clinic. So for this, for mental health, we wanted the location to be in residential area rather than in a commercial place. And we have designed the look and feel of the clinic from inside to be more like a home than actually a hospital. And all of this is done to create a comfortable and convenient way for people to acquire this service, and also providing them a safe and private environment. So that's the second aspect. The third, I think, and the most important aspect is giving them a patient-centric care. The essence of patient-centric care is basically trying to understand people, their values, their preferences, and bringing all of that into the treatment plans. So our care providers spend a lot of time in building that relationship, the trust, and then they use that information to either tap into their support system in some cases, or providing them enough information on whys and how to get better. So these are essentially three core pillars, which we are building as part of our service.
Lovely. That's so, I'm so happy you're doing this as well. But what prompted you to start this mental health service? Like, it is a growing field for sure. It's very important that we talk about this. Yesterday was World Mental Health Day, in fact. So what prompted you to take this first step and be like, you know what, I'm going to start this service that provides mental health service to people?
Yeah, that's a great question. So if you, like, our observation was just having experienced, the service in different, either for family members or for myself, there were a few things which were very apparent. One is it can get cumbersome. Otherwise, it's not that efficient. And third is there's a lack of information in many cases, right? Sure. So I give an example. When you go for your health checkup, annual health checkup, in a lot of cases, you just pick a package, right? So there's no profile done. And when you look at these challenges, they are more pronounced in mental health area, which is already marked with, lack of awareness, more lack of resources, and accessibility. So I have background, I'm an engineer. I have developed products for the last 15, 16 years. And I wanted to take my learning and in the technology space and combine that with world-class care providers and create a much more personalized and patient-centric care. And especially for mental health area, where there's more need to be more personal, to create a more personalized service.
Lovely. Now, in your experience, when you started this, service, how has the response been to the discussions on mental health itself?
So we are just getting started. So
Yeah,
let me just,
yeah.
we are still learning a lot. And a lot of time we are spending in the educational aspect of this, right? So the response has been tremendous, right? So most of the things which we had created with an assumption that it'll make it convenient for anybody who comes and procures the service, to make it less frictional or more frictionless for them. And we are seeing the data. So for example, we have not even had single person who started getting care through Ayoo.Care who has discontinued the service. They really appreciate the convenience of choosing to come in the clinic, and for subsequent interaction might move it to a virtual, which is more convenient for them.
Right.
So far, response has been great, but we are in very early stages, and a lot of our focus is going into creating the awareness and educating people about the service.
Superb, superb. One of the drawbacks of this field is that, it can come across as elitist, only because I have money, or like I need to know about this to actually get these services. But how does Ayoo.Care break that idea of, moving away from the elite idea and bring it to the mass in general?
Yeah. I think a lot of that will depend on how fast can we improve the accessibility of the service for the masses.
Yeah.
And secondly, focusing on the efficacy of the treatment which is given, right? So at the end of the day, if you look at the underlying causes of why mental health issues are, they're increasing, they're same across the board, across classes, right? So it's not that the issues are more prevalent in one versus other, but
Correct.
what's different is the lack of understanding that there is help available, and help can help you improve the quality of life you can lead. So a lot of our effort will go in that direction to bring more, to make this service more accessible to the masses as we learn, and also improve the efficacy of the service as we evolve.
Lovely, lovely. Just wondering, any challenges that you faced while you were developing this app or the service, and how you overcame this, challenge?
Yeah, a lot of challenges, right? So
I'm sure, yeah.
So first and foremost, when you develop a product, right? So before having introduced the product, you make assumptions that what will work for somebody, and will they value the technology you're building, right? So first and foremost was we were leveraging technology quite a bit to create a very personalized experience. Now, the downside of that was we were expecting people who would come and procure the service to be tech savvy at a certain level. So the first thing we wanted to learn is, have we simplified the technology interface to a point where everybody who's coming in can actually independently access the service? So that was initially, we did some research, with friends and family, gave them access to the app, just had them use it, and they basically gave us feedback, which we incorporated to simplify. One of the things I used to tell our engineering team is we want to design an interface where somebody who can use WhatsApp should be able to use, or procure our service. So that's the level of, friction we wanted to, or that's the level of friction we wanted to reduce when it comes to interfacing the technology. So that was first one. And second one, which comes to my mind, is every interaction in our system is digitized, which means like if somebody comes in and a practitioner has to write a prescription, that prescription will actually be a digital prescription, and they'll not walk away with the paper. And there are a lot of benefits of that, right? We can keep track, we keep historical information. So that also meant that the practitioners have to be trained on this new digital interface. And also, the big challenge there is we wanted to design that interface where their load or overhead of seeing a patient and doing the paperwork should not increase than what it already is. So these are two main challenges which came along. But again, as I said, we are still learning. I'm sure there'll be more learnings which we'll incorporate in our services.
Lovely, lovely. Well, I want to thank you once again for taking the time to talk to me and tell me more about Ayoo.Care. It's such a beautiful concept that we can use mental health in this, fashion and get help when anyone needs it. In fact, to know more about this, go to the website, which is Ayoo.Care, AYOO.CARE. Get the app as well. Sahil, once again, thank you so much. Have a great day. And any, last parting words to our listeners out there?
So I think the only thing I would like to highlight is this is our attempt to bring patients at the center of the healthcare service, right? So what we can promise is if you have concerns around your mental health, there is help available, and it's very easily available. And we have created an environment where we can provide you services in a safe and a personalized manner. So that's the only thing I would like to add at the end. But thank you so much, Lee, for having me.
Thank you. Likewise. Have a nice day, Sahil. Take care.
Thanks, Lee. Bye-bye.